Hello, good morning, good evening, everybody. I am Vaidya Asavari Manvikar. I would like to introduce you all and welcome you all to gcar, Global Council of Ayurveda Research, webinar research series. So, gcar, Global Council for Ayurveda Research, is an international non-profit organization based out of USA. Our mission is to encourage, educate, and facilitate basic clinical and interdisciplinary research in Ayurveda. Our vision is to promote and establish Ayurveda as an evidence based health science globally. You can learn more about us at www.ayurvedaresearchusa.org. Please do consider joining us as a member, which will bring you access to all our resources. And no nonprofit can operate and succeed without volunteers. So consider joining us as a volunteer, and we can place you in a variety of projects based off of your skills and your interest. Once again, our website is www.ayurvedaresearchusa.org. Now I would like to introduce our eminent speaker today, Dr. Abhijit Saraf. He is BAMS, MD, PhD in Samhita, and he is also a gold medalist. Dr. Abhijit is the founder and president of the Agastya Foundation in Nashik, promoting Ayurveda education and awareness. He also serves as co-secretary of Ananta Ayurved Pratishthan in Pune and is a trustee of the Sanskrit Bhasha Sabha, advocating for Sanskrit preservation. He plays a key role in Ayurvedic literature as an editorial board member or of Ayurved Patrika and peer reviewer of JAIM. His contributions extend to shaping Ayurveda education, serving on the syllabus drafting committee of NCSIM and the Samhita Text Committee. As a faculty member at MUHS, Maharashtra University of Health Sciences, he integrates Ayurveda into cosmetology courses. He is also an expert panelist for JSSS, a lecturer for the Institute of E-Ayurveda, and member of the Ayurveda Paribhasha Kosha Samiti, working on standardizing Ayurvedic terminology. Dr. Saraf, Dr. Abhijit Saraf, I would love you to start your presentation now.
Sure. Thank you very much for introducing me in this auspicious gathering. Brahmadakshaashvi devesha bharadvaja punarvasu hutashavesha charaka prabhrutibhyo namo namaha sahastraksham ganadhisham swam gurum cha saraswatim janakam janitrim cha shastrado pranamamyam. In this webinar organized by Council for Ayurveda Research and GACR, I welcome you all, and I'm trying to speak little bit I know about and what I learned from my gurus about the Samprapti of Gulma, and we will discuss about some clinical cases which I had experienced during my 17 years practice. So we will start. I will share my screen, and then we will start our adhyanam. So today's topic is clinical elaboration of concept of Gulma. First of all, I will pray to Ashwini Kumaras and the another Ashwini Kumaras who are my guru in this life, that is Vaidya Sadananda Sardeshmukh sir and Vaidya Ananta Dharmadhikari sir. I am speaking this because of them only. So in the Charak Samhita, Yoni Vyapa Chikitsadhyay, there is one important sutra that is always forgotten by physicians. Sutra is Yogaihi eva chikitsan hi deshadi adnyaha aparadhyati. Charak want to say that only the formulations, study of formulations is not the whole Ayurveda. It means when I was in student life and I used to go to Vaidya Ramesh Nanal sir, he ordered me that don't bring any notebook or any pen or anything which you can write down. And another rule was don't ask me anything. And especially he was keen to that I am not looking after only the kalpas which he is giving or the formulations he is preparing. He used to say advise me that please see what I am how I am diagnosing the patient, how I am examining the patient, how I am consulting him. That is very important. So yoga hi eva chikitsam. If some vaidya which is not he's not gone through the sanhitas properly and he's only practicing some ayurvedic formulations like arsha kutharin arsha, kasa kutharin kas, shwasa kutharin shwas, and krumi kutharin krumi. He is not an ayurvedic physician. He's just using the ayurvedic drugs, but he is not the physician. So yoga hi eva chikitsam hi deshadi adnyaha aparadhyati. So he is this is not a good condition to think about only the formulations. So what we have to do, he said that tasma dosha aushadhadini pariksha dasha tatvataha kuryat chikisitam pradnyam na yoga hi eva kevalam. That's why we have to examine the patient according to Ashtavidha Pariksha, Dashavidha Pariksha, and whatever we have to examine him, when whichever examination will be required. That is more important. And then we have to decide about the medications, formulations, upakramas, panchakarmas, etc. according to that examination. Not by Sanhitas also. Sanhitas also gives us the free hand to use anything, but we have to stick with the basic principles. That's why the sutra is saying that na yoga hi eva kevalam. So why we are discussing about this? Because today the topic we are going to discuss is very crucial and very important, but unfortunately in the curriculum of Ayurveda, which is designed previously by CCIM, the more focus on clinical aspects of some conditions like Gulma, Avarana, Vata, Visarpa, Urustamba is not given proper weightage to them. And actually, when we will complete our lecture, we can understand that Gulma is very important. And today also, we are treating them in our day-to-day practice, but we doesn't know that this is Gulma. So we will see the spectrum of Gulma. First of all, I want to emphasize on the thing that there is always a question arises in the physician or a scholar of Ayurveda who is studying the Samhita, especially Charak Samhita. The question is, there are 30 chapters in the Charak Samhita Sutra Sthan. Am I audible na properly? Madam, am I audible na?
Yes, you are audible. It's very clear.
There are 30 chapters in 30 chapters in the Chikitsa Sthan and only 8 chapters in the Nidan Sthan. Why this kind of thing is there? So the 8 chapters described in Nidan Sthan are not the chapters of specific diseases. No, they are the chapters of the symptoms, specific symptoms, or we can call them as a disorders. Means Jwara is a symptom or Jwara is a samprapti. Samprapti means etiology. So that specific etiology can happen in any disease state or any syndrome that is included in that Jwara Chikitsadhyay. So Gulma Chikitsadhyay is there in the Nidan, but Grani Chikitsadhyay is not there. Arsha Chikitsadhyay is not there. Udara Chikitsadhyay is not there, etc. So why such a Grahani is such an important disease and it is not described in the Nidan? Such kind of things arises in that students while we are teaching in or studying into BMS curriculum. So we have to give answers to them, and the answer is that these chapters are not of the sorry for the disturbance. These chapters are not of a specific diseases. It is a syndromes or sampraptis. So while describing the Gulma, we will follow this path. First, we will see Gulma Vyakhya, then Dosha Swarup, Prakop, Swatantra Prananta Dosha Prakop, Samsarga Sannipat, Vata Prakop, and Gulma Samprapti. And we will see 3 cases which I have experiences. I will share that cases along with the treatment pattern. So in the koshas, in the Sanskrit koshas, the Nirukti of Gulma is given as, there are so many meanings of Gulma given into the Shabda Kalpadrum. So the Ekamulaha Sanghat Jataha or Aprakanda Vrukshaha, Stambaha or Truna Jataya means such kind of plant which have his complicated structure, and it is that complicated structure is stuck within each other, within itself, is called as a Gulma. So such kind of the disease structure is like that. That's why it is named as a Gulma. So what is the Vyakhya or definition of Gulma? It is not given in the Chikitsa Sthan or Nidan Sthan, but it is given in the Sutra Sthan. Sutra Sthan Trishothi Adhyay. The definition or Vyakhya is Yasya Vayuhu Prakupitaha Gulma Sthane Avatishthate Shofam Sashulam Janayan Gulmaha Tasya Upajayate. So what is Gulma? It is described in the Adhikarana of a Shoth. That means Gulma is a kind of inflammation. Shoth. The Adhyaya Adhikarana is a Trishothi Adhyaya. And starting from 19th Sutra, the Ekadeshiya Shothas are described here. Means the localized swellings, different kind of localized swellings are described in this specific Prakarana. Like Visarpa, Tila, Kalaka, Neksha, Vyanga, Kakala, Galashuntika, Galagraha, etc. Pliha. So in that Adhikarana or Prakarana Adhikarana, in 29 number Sutra, Gulma is described. That means Gulma is a localized swelling. First, we see that it is a kind of swelling. Now, because of the Prakarana Adhikarana, we apply the Adhikaran Tantrayukti or Prakarana Adhikaran Tantrayukti. We got to know that it is a kind of localized swelling. So where that swelling is happening, there are 3 main things described in this sutra. Yasya Vayuhu Prakupita means Vata Prakop or vitiation of Vayu is must. Without vitiation of Vayu, Gulma cannot be obtained or created. Second thing is that Vata Prakop should happen at the Gulma Sthan. Now, what is Gulma Sthan? They are not described. Here, Gulma Sthana, the Vibhakti of that subject, that word is a Gulma Sthane. It is a Saptami Vibhakti Ekavachana. Deve Devayoho Deveshu Saptami. It is not Bahuvachan. So there must be only one Sthan where Gulma is creating or Samprapti is happening. Third thing which we have to elaborate from this sutra is the main symptom, or we can call it as a Pratyatmaniyat Lakshan in our Ayurveda. Matlab specific symptoms. Without that symptom, that disease is not happening or disease is not be there, is called as Pratyatmaniyat Lakshan. So what is the main symptom of Gulma? It is a Shula Shof inflammation along with the pain. It is the main symptom of Gulma. So we got three things. Vata, vitiation of Vayu is must. That vitiation of Vayu must happen into the Gulma sthana, which is singular sthan, not multiple sthanas. And its main symptom should be pain along with inflammation or inflammation along with the pain, whichever must be there. So that is called as a Gulma. Now, in the curriculum of Nidan Rog Nidan Vishay subject in the second year, or Kaya Chikitsa subject in the third year, while studying the Gulma from the textbook, if a student is studying from textbook, not from the Samhita, he must be fixed in his mind that there are 5 sthanas of Gulma. They are as like here 5 sthanas are Gulma, that is Hruday, Basti, Nabhi, and Parashv. So why are these discrimination is there? We will see later. So along with this sutra, we can apply the Uhya Tantra Yukti, means Adhikaran is Trishuti Adhyay, Shoth and Ekadeshiya Shoth. Then Vata Prakop should be there. But now question arises whether Vayu is Vruddha or Kshina or Swatantra or Paratantra. And now Desha means where that Vata Prakop is happening, it is a Gulmastan and there is question which is Gulmastan. And Lakshan should be Sa Shula Shotha. Now in the Sutrasthan chapter 11, the Gulma is described into Kosthagata Vyadhi and Shakhagata Vyadhi also. What is Shakhagata Vyadhi? That is Dhatu Gata Avastha. Shakha means Dhatu. So Bahirvalyashritam Shakhagatam, Bahir Margajo Gulmo, Yo Bahihi Uttundita Upalabhyate, Bahishya Pachyate Sadnyaya. Means it can be palpable from outside. Anyastu eva Kosthagataha. So Gulma can be happen into the both Vyadhi Margas. Now, before going into Samprapti, we must have know some pre things like what are the doshas. Many times, while listening some Ayurvedic scholars, or we can say them stalwarts, they always used to say that doshas are a hypothetical entity, and I feel bad listening to them. There are so many people who are giving lectures on Ayurveda worldwide, and they are speaking like this, that is doshas are hypothetical or imaginary entity. But sorry to say, that is not like so. Dosha, that is not the doshas. Dosha are body elements. And because of dosha dhatu mala, this body is the body is created or body is developed. So what are the exact characteristics of dosha? First characteristics is it is a Paramanu Swarup. It is a very minute thing. The reference is Charak Sharir Adhyay 7, Sharira Avayavastu Paramanu Bhedena Aparisankhya Bhavanti. I am not going to elaborate this thing because time will not permit me. But there are so many lectures on my YouTube channel. You can refer that for your further study. Now there are 2-3 lectures which are describe only about the dosha, dhatu, and mal. So the dosha are always in Paramanu Swarup. Vayu is also Paramanu Swarup. Pitta is also in Paramanu Swarup, and Shleshma is also Paramanu Swarup. Pitta means not the acid, which is in increase in acidity. No, it is a Sthula Swarup. And Shleshma is not that created into the rhinitis and all other things. No, Shleshma is a Sharira Dhatu, Sharira Paramanu, which is in Paramanu Swarup. Small, minute thing. Another characteristic is it is always rotating in the body. Sarva Sharira Sanchari. Dosha Dhatu Malas are never lodged at one place. They are always rotating in the body. Then question will arise, पक्वाशय कटी शक्ति श्रोत्रासी स्पर्शनेन्द्रियम sthanam vatasa tatrapi pakwadhanam visheshtah. So why these sthanas are described of Vayu? These are the sthanas of Vayu sthanas where Vayu is performing his special functions, or he is very much relaxed there and he's acting there, he's performing there, he can be vitiated there. The Vata Vyadhis can develop in these sthanas very directly, or at first we can see that their vitiation at these places. That's why these special sthanas are described, but Vayu is everywhere. In Amashaya also Vayu is there. In Shira also Vayu is there. Not only in Pakvashaya. Likewise about Pitta and Shleshma also. So it is a Sarva Sharir Sanchari. The three references I had quoted here, you can refer them afterwards. I can share the my PPT afterwards. I will share my PPT also. Another reference, it is very famous reference, that dhatu is also rotating in the body, but Charak says that doshanam apecha evam syat ekadesha prakopanam. So doshas are always in rotating in the body. Wherever is the obstruction, dosha will get lodged. कुपितानाम ही दोषाणाम शरीरे परिधावताम यत्र संगः ख वैगुण्यात तत्र व्याधि उपजायते. Sushruta has described this sutra. Kupitanam, vitiated doshas are also rotating in the body, but wherever it is obstruction or kha vaigunya or sroto rodha, then that dosha will get lodged at that place, and then it will create a disease state. If that kupita dosh, vitiated dosh also keeps rotating in the body, it will not create any disease state. It will create only some little bit symptoms. Like in Vasanta Rutu, we will have some kind of itching in the throat, or some itching in over the body. In Sharad Rutu, we will have little bit acidic acidity in our stomach, or burning in stomach, but that is not a disease. You take some small medications or some change your food, you will be cured. You will not need any major upakramas or any medicine. So they are always rotating in the market. Now another thing we have to know about is dosha prakop. Prakopa means vitiation, and the textbooks which are written in Ayurveda since 1980, they are described that dosha prakopa condition in wrong format. I'm speaking very frankly because someone has to say on this, someone has to comment on this. They had described that prakopa means when dosha leaves his own sthana and go to the another sthan, then it is called as a prakopa. When vata prakopa will happen, when vayu will leave his sthanas, swasthanam tyaktva doshasya punaha margantaragamanam. But here sthana means not the place, because dosha are all everywhere in the body. Where they will leave and where they will go, they're everywhere. So what is exactly prakop? So we have to know about sthana. So sthana means swamana avastha, that is the prakruta avastha, or his normal state is called as a sthana. When any body element is in normal state, functionally, quantitatively and qualitatively, dravyataha gunataha karmataha, that body element is in normal state, then it is called as a sthana avastha. When it will get decrease, it is called as a kshaya avastha, and when it will get increase, it is called as a vruddhi avastha. That is Chakrapani is quoting in these two references. Charak also has described in Vimansthan chapter 4. So then what is prakopa? Swasthanam tyaktva means either that body element is leaving his normal state, and vitiating, that is either it will be in the kshina avastha or in the vruddha avastha. Normal state, rise and diminution. Though the next concept we have to know before understanding the Gulma, that is the Swatantra and Paratantra dosha prakop. We have know about the dosha. What is prakop? Prakop means vitiation, any kind of vitiation. Kshaya is also prakop and vruddhi is also prakop. Now what are the Swatantra and Paratantra? Swatantra means there is vitiation of a specific dosha, And for that vitiation, the hetus which are happen are of that doshas hetus. Swa hetus are there. Means Vata Prakop is there. Vitiation of Vayu, you can observe that. And that patient has obtained, or he is taking that hetus of Vayu only. Means Ruksha, Khara, Parusha, Vishada, Kathina, Guna Yukta, Ahar and Vihar. Then it is that Vata Prakop is called as a Swatantra Vata Prakop. But Vata Prakop is there. But hetus of Vayu is not there. Because of Ama Pradosha, because of a Santarpana, the Vata Prakop is there. Then we can call it as Paratantra Vata Prakop. This is also a descriptive subject. I will just finishing it in some 2 sentences because time is not there for a description of this topic. Now, another last thing which is very important, that how Vata Prakop is happening. We can understand that Shleshma and Pitta Prakop is very, we can understand it because they are the Murta, they are the Sthula Rupas. But Vayu we can see, we cannot see in the body. There are Paramanus of Vayu, but one cannot show us what is Vayu, what is like Vayu is there. That flatulence in the stomach और उसको जो उद्गार आता है तो वो this is not the vayu. So what is vayu? That is a very important thing before understanding the Gulma. So in the Vatakala Kali Adhyay, the qualities of vayu is described by Sankrutyayam. Luksha Lagu Shita Daruna Khara Vishadaha Shadi Me Vata Guna Bhavanti. These are some qualities of vayu. Then how Vata Prakop is happening? He says that Kumar Shira Bharadwaj says that Satu evam gunaihi evam dravyaihi evam prabhavaihi cha karmabhihi abhyasyamanaihi vayuhu prakopam apadyate. That qualities rukshadi gunas, the dravyas having rukshadi gunas, prabhav having rukshadi gunas, and karma having rukshadi gunas. Because of this guna, dravya, prabhav, karma, vayu is vitiating. So in Vatakala Kali Adhyay, the Vrudhyatmaka Vayu is described. Vrudhyatmak Vayu is described. So now Kankaya and Bhallik describe that what is Vata Prasham? The qualities opposite to the Vayu, that is Snigdha, Ushna, Guru, Manda, Pichila, Shlakshna. These qualities, that Dravyas having these Snigdhadi qualities, Karmas having these Snigdhadi qualities, will perform the Vata Prasham. But what is Vata Prasham? Sorry again. They are not described here. Call yeto ani gadbad. So what is Vata Prakop then? Badish Dhamargaon has described in Vatakala Kali Adhyay. He says that Vata Prakopanani means hetu of vitiation of Vayu. What they create? First they create Ruksha, Laghu, Shita, Daruna, Khara, Vishada, Shushira, Karani, Shariranam. That Sharira, that body or that Srotas will become Ruksha, Srotas will become Laghu, Srotas will become Shita, Srotas will become Daruna, Srotas will become Khara, Srotas will become Vishada, Srotas will become Shushira, means perforation can be there, roughness can be there, coldness can be there, lightness can be there, roughness can be there. Tatha Videshu Sharireshu, the Srotas which is having Ruksha, Laghu, Shita, Daruna, Khara, Vishada, Shushira Gunas, in that kind of Srotasa, Vayu is flowing along with its another Dushas and other Doshas. They will get obstruct there. Vayuhu Ashrayam Gatva. And then Apyayamanaha. Now that block will get increased. How it is increased? I want to show some diagrammatical representations. Now this is a Prakrut Srotas.
Dr. Abhijit?
Yes?
The the audio is good. It's all going good, but we cannot see the presentation.
Why? Okay, just a minute.
Yeah.
Screen is share, ma'am.
Yeah, but we are not able to see it.
Now you can see me.
Yes, I can see you.
I will share again.
Okay, okay.
Now it is screen is visible.
The screen is visible. Yes. You are explaining the very important and very difficult topic very well. It's just the issue with the.
Now it is okay.
Okay, yeah, this is good.
Yes. So we were discussing about the Vata Prakop. So this is the Prakrut Srotas. Some just imagine that it is a Medova Srotas. And small Paramanus of Meda and other Dhatu Paramanus also are flowing through this Prakrut Srotas because of the Gati of Vayu. Vayu Pitta, sorry, that sutra is very famous. Pittam Pangu, Kafa Pangu, Pangavo Maladhatavaha, Vayuna Yatra Niyante Tatra Varshanti Megavat. It's very famous sutra. So this is a Srotas Prakrut. It is having its qualities in proper manner, in proper quantity. So there is no obstruction, no Khavayigunya, nothing vitiation is there. So that flow is very good and that functions is happening very good. So now what happened in the Vata Prakop Avastha first? If that person is having hetus of Vata Prakop, means Ruksha, Khara, Shita, Parusha, Vishada Gunas, Karmas or Dravyas he's taking and continuously he's taking that, then that Srotas will slowly it will become Ruksha, Khara, Parusha, Shita, Daruna, Vishada, ityadi. So now that Srotas is losing its normal structure and becoming rough or cold or stiff or having some perforations, and that is the first stage of Vata Prakop, that is Rukshadi Sharira Yukta, that Srotas will become Rukshadi, excessive Rukshadi gunas are there. Now second stage, this is the sutra of Vata Kalakali. Now what is the second stage? Now that flow is going through that Srotas, and Srotas is becoming excessive Ruksha, excessive Khara, excessive Shita, excessive Kathina, etc. Now imagine a pipe is there, it is created newly, and it has a smooth surface internally. And now that water is going through that pipe very easily because the inner surface is very smooth. After some days or years, continue flow because of continue flowing of water and other things, that internal surface of that pipe will get some kind of roughness is there, or some pits can be there inside that, some pits will be obtained. Now if that water is taking some kind of thing which is get obstructed in that pit, now some cloth is going to flowing through that, the cloth with gets obstruct, then some clay or some kind of some other things like some anything which is flowing with the body which is get obstructed. Now the 20% block will be there, now 40% block will be there, 60% block will be there, 80%. Now that block will get increased, and total block of that pipe, same thing is happening in the body. That's why we can observe in the coronary heart disease or portal vein hypertensions or cerebral hemorrhages or any kind of or varicose veins, same thing can happen. It is happening. It is called as a Swatantra Vata Prakop or Shuddha Vata Prakop. Obstruction because of its own gunas. Here the inner flow is not vitiated. That Meda is not vitiated. That Rasa is not vitiated. That Sheshma Pitta is not vitiated. But Srotas is vitiated, having Rukshadi gunas of Vayu, and because of that, that flow is gets obstructed, and now it is getting increase in the quantity, and then total block will be there. So this is called as a second stage, ashray, or it is called as a lodging, or it is called as a sangha. Sthana samshray is also there. It is called Puro Rupa Avasthas are starting creating in this stage. Now third stage is the apyayama. Now that block will get increased. but some little space will be there. So little bit flow is going there. So no paralysis or no hemorrhage or no arrest will be there. So what is the fourth stage, last stage? It is described in the Shwasa Chikitsa. It is called Udiran or Vimargaman or Tiryagaman. Now that total srotas will become blocked. There is no chance of flowing. So that flow will get vitiated from for either another direction. It can be reverse direction. It can be left. It can be right. It can be downward. It can be upward. Wherever it will get space, that flow will be there. And if that pressure will increase, the hemorrhage will be there. Cerebral hemorrhage or in inner bleeding in any way, any vein or any artery. I will give an example. There is a flow of river. River is flowing very smoothly. We created a dam in that that river. So what happened? The backwater will be there. Wherever there is place, that water will take place, and villages are get down into that water. And the uh, after the where we have considered a dam, the further thing will get decrease in the water level. So at the same times, there is vruddhi also and there is a kshaya also. Same thing is happening in this Vata Prakopa. So this is a fourth stage of Vata Prakopa. So now what is Vata Prasham? Opposite. Vata Prasham means not like that we think that there is a Sandhigata Vayu, means in Janu, knee joint, there is a Vata Prakop, means Vayu will flow from Pakvashaya, goes to the knee joint, then it will get obstructed there, the knee joint will be get swelled, and then there is a pain, swelling, etc. It is called as a Sandhigata Vata Prakop or Vata Prakop in the knee joint. No, it is a bullshit. It is not according to the Samhita. This is described in textbooks of Ayurveda. Just throw them away. Follow the Samhitas. Charak, Sushrut, Vagbhat, Kashyap. That's it. So what is Vata Prasham? So when now that there is a Vata Prakop is there, what treatment will follow? Snehan, Svedan, etc. The Vata Upakram. So because of that Sneha, Sveda, Guru Adi, that Srotas will now become slowly Snigdha, Guru, Ushna, Shlakshna, Mrudu, Pichil, Ghana, etc. Srotas will become Snigdha, Srotas will become Guru, Srotas will become Ushna, Srotas will become Shlakshna, Mrudu, Pichil, Ghana. Now in that kind of Srotas, Vayu will flow. Now that block will diminish slowly, Asajjamanaha. Now slowly that block will get nullified. Slowly one paramanu, then another paramanu, that will get, that is called as we perform in Pururupavas, Purva karmas in the of the Shodhan, Snehan Svedan. We have to make Lina doshas flow from dhatus to the koshtas. Shakha Koshtagati. That is described here. So Asajjamanaha Charan, the Vayu will flow with along with his doshas without any obstruction, is called as Vata Prasham. Vayu is flowing throughout the body without any obstruction and performing his normal functions, is called as a Vata Prasham. Vata Prasham means not decrease in the Vata Gunas. No. Now next, this is again without, because of treatment, with that Srotas will become Prakrut again. Now what is Vata Vyadhi? Gulma is a kind of Vata Vyadhi. So what is Vata Vyadhi Samprapti? Without understanding the Vata Kalakali Adhyay, we cannot able to decode the Vata Vyadhi Samprapti. So Dehe Srotaunsi Riktani Purayitva Anilobali Karoti Vividan Vyadhin Sarvanga Ekanga Sanshrita. Dehe Saptami Vibhakti means in the body. Riktani Srotaunsi. Srotas is a Rikta. Now the meaning of Rikta in Vyavaharik Sanskriti is called as a vacant. But Srotas will never be vacant. Either Dhatus will be flow through the Srotas or Ama can be flow. There is no, never a Srotas is vacant. So what is Rikta? Chakrapani commented on that. Rikta means Snehadi Guna Shunya. That is Rukshadi Guna Yukta. Means when Srotasas of the body of that person is become excessive Rukshadi Guna, then Vayu get obstructed there. that Vayu will obstruct, but another Doshas will also obstruct. Sometime Meda will be there, sometime Sheshma will be there, sometime Pitta will be there, sometime Rakta will be there. And which Dosha is obstructing there, the symptoms can be varied. Means Pakshaghat will be there. But if Dosha is changed, the symptoms of that Pakshaghat can change. So Karoti Vividhan Vyadhin Sarvagna Ekanga Samshrita. So many kind of Vata Vyadhis can obtain there. So now we will come to the Gulma, because without understanding these concepts, we cannot able to elaborate the Gulma. Now, what is Gulma? We have seen this sutra. Yasya Vayu Prakopita. Now we know about Vata Prakop. That means first, any specific srotas or whole body will become excessive Ruksha Gunas. Then at that place, that another flow, the flowing dhatus or dushas will get obstructed, ashraya. Then their block will be increased, apyayana. And when the whole srotas will be get blocked, it is having udaran or vimaragam. The total samprad is called as a Vata Prakop. Now, where this Vata Prakop is happening, it is happening in the Gulmasthan. Now, what is Gulmasthan? We will see later. And because of this vitiation of Vayu, the Sarshula, inflammation along with pain will happen. It is called as a Gulma. Now, there Gulma sthanas are described, that Pancha Gulmaha, Bastav Nabhyam Rudhi Parashvayo Sthana. Now, in this sutra, only Ekavachan is there, Gulma Sthane. And here 5 are described. That means these are not the sthanas of Gulma Sampraptis. So, what are these sthanas? We will see. Now we will start the Gulma Nidan. These are the hetus of Gulma. But this I say this sentence that this is a hetus of Gulma, but this sentence is wrong, because these are the hetus of Vata Prakop, not the Gulma. Read the last sentence. Tasya apacharat Vataha Prakopam apadyate. These are the hetus of Dosha Prakop, means Vata Prakop. Now, because of this vitiation of Vayu, what is happening? Read first sentence. This is a Nidan Sthan of Gulma. Charak Nidan, chapter 3. Sa Prakupitaha Vayuhu Mahasroto Anupravishya. Now, what is Mahasroto Anupravishya? Means when Vayu is not there in the Mahasrotas before vitiation. No, Vayu is flowing all over the body. In Mahasrotasa also, what is Mahasrotas? GI tract. Means from mouth to anus. It is called as Mahasrotas. In that GI tract, whichever place this etiology can happen. So what is Mahasroto Anupravishya? It means first that Mahasrotas will be having excessive Ruksha Diguna. Srotas will become excess Ruksha. Say Srotas will become excess Shita. Srotas will become excess Khara, Parusha, Vishada, etc. And because of Raukshat, Anupravishya, then that block will be there in the Srotas, then Vimargaman will be there. Now, because of Raukshat, Charak is saying that Raukshat Kathini Bhutam. Now, who is become Kathin? Vayu is not becoming Kathin. Srotas is becoming Kathin. See Chakrapani. What is Chakrapani saying? Raukshat Kathini Bhutam iti Maha Sroto Visheshanam. Mahasrotas will become Kathin. Kathin means hard, stiff. Because that first they become Ruksha, excess Ruksha, and now that flowing Parmanus will get obstruct, Ashray, Apyayan, Udiran, and it will become Kathina. Then that flow is the flow is flowing. No? Now that flow doesn't have any marga to flow. So road is blocked. So what it will give? It will flowing through another direction. It is called a Pinditaha Avasthanam Karoti. And then what he will create? Rudhi Bastav Parashvayoho Nabhyam Va Sa Shulam Upajanayati. These 5 are the places of pain. What is Ruday? Ruday means not heart. No. Basti means not bladder here in this context. Then what are these 5 sanas? We will see. But these are not the sthanas of Gulma. These are the sthan of Shula Abhivyakti. Patient will come having Shul in that places, but Samprapti will be in the Mahasrotas. Now the symptoms will be there. Granthi, Anek Vidhan, Gulma Ityabhidiyate, Muhu Adamati, Alpato Apadi. That are the symptoms. It is very easy. I am not going to describe them. Samprapti is very crucial. Chakrapani Tika is there. So Kathini Bhutam is a Mahasruta Visheshan. Now we have very well known or words with 9 quadrants of abdomen. This is a diagram. So that 5 sthanas, Rudhi, Basti, Nabho, these are the 9 quadrants of abdomen, and Charak has known about these 9 quadrants. Now what is epigastric? The second number place quadrant means middle upper quadrant is called as a Rudaya Sthan because it is near to Rudaya. The number 5 means middle quadrant is called as a umbilicus. It is a Nabhi Sthan. Number 8, lower middle quadrant is called as a Basti Sthana because that is the area of Mutra Vahasrotas. And number 1, 3, 4, 6, 7, 9 means upper, middle, lower, lateral, both lateral quadrants are called as Parshva. So both Parshvas, lateral, left and right. Parshva means lateral Pradesh, lateral part. So these are the 5 kind of sthanas: Rudaya, Basti, Nabhi and Parshva. Now patient will come having pain in that place. Like in appendicitis, what is the exact point of pain? McBurney's point. So patient will tell you the exact point of the pain, and with that exact pain point, you can diagnose that he is having appendicitis before doing the USG. So pain is a Parshva Pradesh, but where that Shotha is there, where the inflammation is there, in the Mahasrotasas. So appendicitis is a kind of Gulma. Now we will see ahead. Okay. So this is the Sampraptis. I am just quoting the references. I'm not going into detail into the Pitta Anubandha, Vata Anubandha, Kapha Anubandha. This will take another half hour. This kind of Sambandha. But in Gulma, Vayu is very important. Without an vitiation of Vayu, Gulma will not be there. So now, what is the Gulma? It is happening in the Mahasrutas. What is Mahasrutas? From mouth to anus is called as a Mahasrutas or GI tract. So any inflammatory disease having etiology in the Mahasrutas is called as a Gulma. I will share some names, just these. All inflammatory diseases or symptoms of GI tract. Now what modern science has quoted about these all are the Gulmas: mouth ulcers, esophagitis, gastritis, colitis, appendicitis, rectitis, piles, duodenal ulcer, jejunal ulcer, gastric ulcer, intestinal ulcers, all cancers of GI tract means CA esophagus, CA mouth, CA tongue, CA stomach, CA jejunum, CA duodenum, CA large intestine, CA small intestine, CA appendix, CA rectum, CA anus. Then jejunal atresia, tumors of GI tract, all kind of tumors, benign and malignant both, diverticulitis, all kind of obstructions, all kind of intussusceptions, hernias, inflammations, duodenitis, IBS and peptic ulcer diseases are included in Gulma Sampraptis. So Gulma is not merely just a ball of Vayu obstructed in the gut. No. It is all inflammatory diseases symptoms. Even perforations, ulcers and having perforation, gastric perforation, intestinal perforation, duodenal perforations, all perforations are also included in Gulma. How? We will see the reference. See, in the Charak, the cancer stage is also described. I will share the references. Here, Vata, Vataja Gulma is described. And he is quoting that last two lines we will see. Karoti jirane abhyadikam prakopam. Means after the digestion of food, that stool will get increased. And bhukte mrudutvam, when that patient will eat, that pain will get subsided. It is kind of ulcer. So it is a Vata Jugulma. In Pitta, Jwaraha, Pipasa, Vadanangaraga, Shulam, Mahajjiryati Bhojanecha. When that patient will eat, the stool will become excessive, like gastric ulcer. Sweda, Vidaha, and important word is a Vranavacha. Vranamit, what means having wound is not the correct meaning. Vranavat means like, wound like. Means that Gulma will be there first, then wound will be there, perforation will be there. It is called as a Pittash Gulma. And you can see any CA, these symptoms are always there in associated symptoms of CA. Jwara, Pipasa, Vadanangarak, Shul, Swed, Vidaha, and wounds, ulcers, ulcerative colitis, etc. In the Kafash Gulma, it is said that Staimitya, Shita Jwara, Gatra Sada, Rullasa, Kasa, Aruchi, Gaurav, Shaitya, Rugalpa, and important means Kathina Unnatatvam. Means you can palpate from outside. Such kind of hard structure in the intestine. It is a cancer nowadays. So it is described in Charak Samhita. So Agni and Gulmas are also connected. Mande Agno Vardade Gulmo, Dipte Agnu Prashamyati. When that's why in the Gulma treatment, we have to perform Deepana very well. Deepana and Pachan is the first line of treatment in any Gulma. Now this is another reference of some kind of cancers. Sanchitaha Kramasho Gulmo, Mahavastu Parigraha, means slowly at one place some kind of hardness will be there. Now it will get increased and having Mahavastu Parigraha, means metastasis will be there. Metastasis. And Krutamulaha Siranaddo, now it is very firm into that intestine. And Kurma Ivonnataha, like it is having the Kurma, Kachua जिसको कहते हैं ना, tortoise, that the shell of tortoise, like the hardest thing in the world, one of the hardest things. So like it is a upama. So that kind of hardness you can feel in the intestine or outside, from outside of in the udar parikshana. So this is also kind of, and see the symptoms: Dorbalya, Aruchi, Rullas, Kas, Vamman, Ati, Arati, Jwara, Tushna, Tandra, Pratishay. These are the associated symptoms. Nowadays also we can see in the any kind of cancers. So here in Charak also, he described that Gulma, some avasthas of Gulma are not the place to perform Kaya Chikitsa or medicine. It is a avastha of surgery. So he says, Vidaha Lakshane Gulme, Bahistunge Samunnate, Shave Sarakta Paryante, Samsparshe Basi Sannibe, Nipidete Unnite Stabde, Supte Tat Parsha Pidanat, Tatreva Pindite Shule, Sampakvam Gulma Madished, Tatra Dhanvantarena Madhika. Now here, that surgeon should be perform the treatment. Surgery should be performed. What kind of surgery we have to perform? That also Charak describes. So surgeries are described in Charak Samhita also. In Shota Chikitsa, in Udara Chikitsa, in Gulma Chikitsa, it is described. So now we just have the short bird view of Gulma Samprapti. Now I will share 3 cases which I have observed and I have treated. First case of 15-year-old girl who is studying in 10th standard, suffering from a severe pain in abdomen. and specifically pain at McBurney's point, that is right lower lateral quadrant. Associated symptoms were vomiting, high-grade fever, headache, and weakness. And in USG, acute appendicitis is observed. She was having her board exams in upcoming days, or some kind of examinations will be there, were there. So her parents were against the operative treatment because she can miss that exams, and that they want to postpone the procedure, and that's why they came to my consulting. And uh, the way I have learned from Vaidya Dharmadhikari sir how to diagnose a patient, I am always doing that condition. It is very simple. So this is my that this the table you are seeing is it in from my case paper. I always take case along with this table. Write down the symptoms as per the patient is describing, because patient is always tell you the symptoms which is having grave problems in his body, major symptom. He will not say I am having diabetes. No, he will say I am having some kind of weakness, or having giddiness, or a headache, or not feeling well, etc. Then he will say I am having diabetes from 10-20 years, but he will tell you the symptoms. So write down the that symptoms as per the patient says. Then write down the period from how many days that symptom is happening. Now write down the tentative doshas which are creating these symptoms. Now try to write down the gunas which are vitiated. Means vata prakop will be there, but vayu is prakop vitiating from which guna? That is the this thing I learned from Vaidya Sir Deshmukh sir. Means a specific patient is there, pain in knee joint, but vata prakop is there, vitiation of vayu, but because of which guna? Headache is there. Now headache, shirashula is a vata pradhan symptom, but because of which guna headache is there? We have to study about that. So try to write down the gunas, and that symptom is happening which srotasas? Write down. So pain in abdomen, it is a vata dosha, ruksha guna, and annava srotas. Vomiting, vata pitta and amavastha, tikshna drava guna, and annava srotas. Nausea, vata pitta am, snigdha guna, specifically snigdha. Other gunas can be there, and in annavaha. Headache, vata pitta am, ruksha tikshna gunas, and it is in rasa because specifically rasa srotas. Fever, vata pitta in that patient these are the doshas and gunas. It is not generalized. Ushna truksha and annavan rasava srotas. And weakness, vata pitta and drava tikshna ushna gun and annava rasava srotas. So what are the doshanubandhas according to the symptom are vata pitta. But in the examination, in udar parikshana, pain is not aggravating after perpression. So this is a classic symptom. Now we have to assess that whether that vata prakop is swatantra or pardhanti, that pitta prakop is swatantra or pardhanti. So what are the hetus I found? Amla vidahi snigdha tikshna. Every Sunday she is eating misal. Every Sunday she is eating pav bhaji. In between the colleges she is eating vada pav, samosas, and that's why amla vidahi snigdha tikshna guna yukta ahar. Then because of examinations, she's ratro jagan is there, waking late night, sleeping in late night is there, and stress is there. So all are the hetus of santarpanjanya and am pradoshjanya, and aggravating the vata anubandhi. So my nidan was santarpanjanya, am pradoshjanya, avarana yukta, vatanubandhi pitta gulma, because it is in mahasrotas. Swelling is in mahasrotasa, and srotas means annava srotas. So what chikitsa I have every time, whenever such kind of patients are there, we should perform the Deepan and Pachan. So the patient is not allowing me to do long term of treatment because she want to appear the exam. So I give Rasapachak, means Kalingaka, Patolasya, Patha, Katu, Rohini, Sut Shekhar, and Punarnavadi Yog. It means Punarnava, Gokshur, Haridra, Musta, Sariva, Shatavari, and Dashami. So all dravyas are Tikta Rasas, having majorly Tikta Rasa. Why I choose Tikta Rasa? And Tikta Rasas having Shitavirya? Because Tikta Rasa is the only rasa which will perform the Pachana, which is shoshak also, and which is performing aggravated pitta. It will diminish the pitta also. And if SOS means if pain is measured, then give Lavana Bhaskara Churna and Gruta. Udara Svedana advice, daily thrice 4 times Udara Svedan should be there. And banana, milk, curd and cucumber should be avoided temporarily till she become swastha. The banana, milk, curd and cucumber, these 4 padarthas, the 4 food items are prohibited. Why? Because they are performing santrapadana and obstructions. Now in the 7 days only, pain is subsided totally. She is feeling like that heavy abdomen is not there, lightness in her right side of abdomen, and no pain. Then she face her examination, and then again in the second follow-up, with the help of other symptoms, I gave her Pravala Panchamrut Vati, Vijaya Vati. Now what is Vijaya? It is a kalpa of Bhanga. So it is a good painkiller according to Ayurveda, and now it is available all over India. And Punarnavad Yoga is started and rest city on. So you can see the before treatment USG, it is saying that a thick walled appendix is visualized in the right iliac fossa, measuring approximately 5 mm in diameter and 6 to 7 in the length. 18 mm and 28 mm and 24 mm size cystic lesion with multiple internal septi in right ovary, mostly hemorrhagic ovaries. That is also she is suffering. Mild free fluid in pelvis, and other rest are very normal. So swelling in appendix, thick walled appendix is there. This report is having date of this report is 6 December 2023. Now after the treatment, we perform again USG on 15 June, means 6 December to 15 June, 15 January. It's only 1 month. What is the so the same thing, same place we perform the USG, see the USG, no significant abnormalities seen. With the help of very small medications, very easy medications, Udara Svedana, prohibiting some food items, we achieve this. So this is a Gulma. And I advise her, if you eat banana, if you drink milk, you have to perform, you have to go to the surgeon. Then I cannot do anything. Then she is cured very well, and now she is happy, and she is now in her 11th and 12th facing the next examinations. So this is a kind of Gulma, Pittaja Gulma. Now second case, 25 years male patient, symptoms were pain in anal region, bleeding per rectum, swelling in anus, flatulence, bloating, abdominal pain, etc. And diagnosed as a bleeding piles. That previous doctor was diagnosed and advised for surgery because heavy bleeding was there. Now I, with my regular thing, hetus were irregular food, amla vidahi food, irregular sleep, and stress. So what is my nidan? Pittasha Gulma, and sthan is Guda, because Guda is a part of GI tract. Anus is a part of GI tract. That's why Arsha is not described in the Nidan sthan, because it is Gulma. But in the treatment, Chikissa sthan, the Chikissa of Arsha is some specification. That's why the another chapter is created. Grahani also is a kind of Gulma. Where inflammation is there in the Grahani Samprapti, that is Gulma. So that in the Nidan sthan, Grahani is not described. But in Chikissa sthan, it is had different specifications. So another chapter is created. Likewise, so sthana is Guda, Pittasha Gulma, Pittanubandhi Vatasha Gulma. Swatantra Pitta Pratantra Kapha was my diagnosis. So I gave that patient Nagakeshar, Shatavari, Sariva, Haridra, Punarnava, and Gruta. Means we have to give them Tikta Kashayaras. We have to perform the Stambhana of Rakta. Also, we have to do Deepan and Pachana, and that's why Tikta and Kashayarasa are the choice of drugs. So that rasa are choice of rasas. So Shatavari is a kind of Shatavari is having quality of anti-inflammatory. Nagakeshari is a Rakta Stambhak. Sariva Haridra also perform on Rakta Dosha. Haridra is also Rakta Stambhak. And Punarnava is also anti-inflammatory. So, and Gruta is Anupa, because Gruta is also Pitta Prasham. then Lagu Sutshekar Vati and Shankhavati. And with this only small treatment, within 5 days, patient get cured and the symptoms will get vanish. And but after some time, he started again that kind of food habits, and again he's facing that bleeding piles. And that patient was wanted to appear on the police academy, examination of police academy. So before that examination, he told me that I have to be cured. So we performed some kind of virechana afterwards, then some nirobastis and yogabastis, and then he cured very well after that. But immediately, this only small treatment gave him relief from that building plies. No kind of surgery is required in this patient. I have such kind of patients. That patient doesn't listen to me, and then they perform the surgeries, and they now suffer in the grave problem. Many physicians have they have same things in according. This is the beauty of Ayurveda. Now the last case, 36 years of male patient, and he's suffering from gastric ulcers since 5 years. He's taking medications, uh, allopathic medications for gastric ulcers, perform scopy also, but some for some period he was feeling well. Then again that symptoms were aggravating. Likewise, his on and off was there. What kind of symptoms? Heavy pain in abdomen, vomiting, severe burning in abdomen, burning pain increases after the intake of food, and headache and nausea. So again, I perform all these nidanas, and I give Prava Panchamrut Vati, Dadi Mavaleha, and Grahani Kapataras. Grahani Kapataras is one of my favorite kalpa, and Prava Pancham is also my favorite. Dadi Mavaleha is also good choice of drug in this kind of conditions. And within a 3 to 4 follow-ups, he got relief, total relief he got. Now afterward, we perform a small vamana, sadhya vaman. Then proper virechana will given advise him. He take the proper virechana. Then after 15 to 20 days, we perform niruha basti, and we gave him small patya. I never give any patient list of apatyas. Means you should avoid these 100 things we advise that no. I tell them patient, uh, you can eat whatever you want to eat, but eat at a proper time and proper quantity. Many diabetic patient ask me always in this period, means April May, doctor, can we eat amarasas, mango pulp, can we eat mango juices? So I always said eat it, because we are living for eating, no? So eat it. So but in proper quantity, only half bowl. And after the amrasa, you should drink boiled water along with the maricha. I don't remember the English name of marich. Piper nigrum. Okay. So this kind of things we can have. So what is the Saransha of Gulma? It is a inflammatory disease uh, creating or developing in the Mahasruta, that is GI tract. Any inflammatory disease in the GI tract is called as Gulma. Vitiation of Vayu is very important. That 5 sthana described are not the sthanas of Gulma, they are the sthanas of Shula, means pain. And their Visheshan of Vayu, 4 stages are very important. In the Gulma, Swatantra Pratantra concept is very important, and importance of Agni is there. We have to perform Deepan Pachan in every kind of inflammatory conditions. Even in the thyroid also. Yeah, this is not a Gulma, but in thyroid condition, same things, but Srotas is different. We have to perform the Deepana Chikitsa first. So that's it. Thank you very much. Thank you for kind listening, and I hope I speak well, and I try to elaborate what I know little bit about Gulma. Thank you very much.
Thank you so much. It was very insightful, very informative, excellent presentation. So,
Dr. Abhijit, sorry
Yes.
for interruption. Sir, this is Dr. Chakravarti from Chennai.
Ji, namaste.
I listened to your talk. Namaste. Very analytical, and you have incorporated many fundamentals in your discussion. I am very glad to listen to it.
Thank you, sir. Thank you very much.
And I want some explanations because I am also in teaching field.
Yes, sir.
So you were using while explaining one example, Srotas, Vata Prakopa, and establishment of Lakshanas. In terms of gunas, of course, involvement of gunas is to be thought of. There is no other go. It is true. But what do you think of if the Ruksha guna, what is to be thought of? How to understand Ruksha guna in the Srotases? How do you say? Do you say that is it hardness or rather to say roughness or dryness? What do you want to say?
Okay.
Ruksha guna in
Sir,
Srotas.
I will try to elaborate, sir. It is very important question you have asked. I have avoided these things because in 1 hour the whole thing cannot be explained. But now you have raised this thing, I will definitely try to answer. Sir, in the avasthapakas, we have three avasthapakas and these avasthapakas are of mahabhutas, not the rasas. So madhur avasthapak means where parthiv and apya paramanus are get separated from the panchabhotik food. Then in the ambla avasthapakas, parthiv, Parthiv and Agneya Paramanus are get separated, and in the Katu Avasthapakas, Agni and Vayu Mahaparmanus will get separated. But Akash is not having any Paramanus; it is a Vibhu Dravya. So when after whole Avasthapakas, some Paramanus are there which is having qualities of Ruksha, Khara, Parusha, Vishada. So what is Ruksha? That it means that Paramanu having Ruksha Guna, wherever that Paramanu flows throughout the body, it will create some kind of Lekhana Karma, some kind of roughness, some kind of thick stiffness. So it is not a specific one meaning is there. It is having many shades. So Hemadri has given some definitions of guna in first chapter. Ashtang Hruday, chapter first, Vimshati Guna. Guru Manda Himas Nidashtakshna Sandra Murdustira. There Hemadri is commented. So Lekhane, some kind of Langane.
Yes, sir. Yes, sir. But Abhijit, sir. Yeah, you have pointed it out very rightly. Keeping that in mind only, I am asking. There,
Yes,
Hemadri has commented on 11th shloka of Ashtanga Hridaya Sutrasthana,
yes,
where gunas of Vata and other doshas are described. And over that, he told Rukshata is nothing but a Soshane Karmani Sakti is a Ruksha.
Totane Ruksha.
So there are there. I think they are to be considered as the relativistic. There,
Yes, sir.
you are taking about the Paramanu level of Panchabhotik.
Yes,
It is true
yes, sir.
that Panchabhotik configurations are to be considered. Yes, it is true. But as a
Yes,
nutshell, probably Roksha Guna may not be directly to be considered as roughness or dryness at that context. What I mean to say, over the
no,
skin and other observable things, why? Because within the srotases, we cannot perceive with the tactile sensation or with your chakshus. Both the
yes,
things are not to be taken. There,
yes,
we cannot conclude that rukshata is roughness or dryness. I think the Soshanata will be brought in excess, what it must be. And, probably that could give you some more explanation. Rather, my sayings are adding to your
definitely.
explanations also.
I
So,
I want to add one thing, sir. I want to,
Yeah.
sorry to interrupt you. I want to
No,
add
no problem.
here,
No problem. Yeah.
adhikaranas are different at different places. Like,
Sure, sure, sure.
and in
Adhikana
Ayurveda,
Siddhanta. Yeah. Yes, it is true. True,
pattern of
true,
writing
true.
Samhita
I
is like they
will
use
say
same
that.
word in different
Yeah.
meaning at same places. Like
Yeah, yeah,
rasa
yeah.
means
Yeah.
parad also, rasa means atma also, rasa means taste also, rasa
Yeah.
means
So it
asas
is
also.
true.
We have
It
to
is
choose
true.
the meaning. So ruksha in the context of Vimshati Guna is a shoshan. But for
Yeah.
shoshan also required dryness and roughness. So these are the shades of ruksha gunas. And we have to elaborate in the what is the importance of Hemadri in same chapter, the next sutra, Koshtha, sutra of Koshtha, he has elaborated the yoga vahitva of Sheshma. No other commentator has described that.
Yeah, yeah. And
So this is the
Gunasankara.
beauty,
Gunasankara. That
beauty of
Sankare
Yes,
Gunasankare also he told. Yeah. Yes,
it is the
yes.
beauty of Hemadri. Yes, yes.
Yeah.
So
Yes.
we always consider it is not ekantik. We have to consider
Yes.
many shades of that thing always
Sure,
in
sure,
Ayurveda.
sure, 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 sure.
But
Yeah,
thank
yeah.
you, sir, for
It is to be.
your
Sir,
thoughts.
sir, for research purpose also, what I mean to say, for research purpose, if you take up this kind of fundamentals, I am on the way to achieve something. If we focus our students in this way, probably it will give some other new pathway. Just correlation is not enough. What I mean to say, you have rightly pointed out in describing the samprapti of Gulma and where importance of doshas are to be highlighted. It is very enlightening, sir.
Thank you.
Okay, I
The
am
goal is
very much
always wrong.
thankful to this. Yeah, yes, sir. So where you are working, please? May I know?
Sir, I'm working in Nasik. I'm a professor and HOD in Sanhita department, and also I'm practicing here. In a private
Thank
college, I'm
you,
working
thank you. So we are
more.
all sailing in same boat. I am also a professor of Samhita as a
Oh,
practitioner. Very good,
sir,
sir.
I will be in
Yes, sir.
Chennai in 24 April. I will be
24th April. I
Anna
could not get
University
you.
Department of
Yeah,
Biotechnology. I have a lecture there.
very good, very good. But I shall try to meet you. I shall try to meet you. I am residing in Chennai only. Sir,
Sure, sir.
let me share my number and I will.
Yeah,
Okay,
in the next.
I will meet you. Please.
Thank you so much, sir, for such a
Thank you
uh,
very much.
very important
Thank
discussion.
you. Yeah.
And there
Very
is
nice,
one
sir.
question actually I see in the chat box. So that is by Dr. Shweta. Swasthana Vimarga Gaman can be attributed to vitiation in the guna of dosha, change in the prakrutik swabhav, excess tikshnata or sneha in pitta is Vimarga Gaman from Swasneha. So I'm going to.
Yes, we.
Mhm.
I will try to elaborate this. Pakvashe, Kati, Sakti, Shrotra, Asthi, Prashanendriyam are the sthanas of Vayu. So if we say, as per the textbooks are written, not the Sanhitas, they says that when dosha will left their place and will flow from the another places, it is called as a prakopa. But it is very incorrect. Because I will give an example. There is a Ayurvedic college, and at the same floor, there are three departments of first year: Sanhita, Sharir Rachana, and Sharir Kriya. Now, all the teachers of that departments are working in their departments for till the lunchtime. But in lunchtime, teachers of Kriya department and teachers of Sharir Rachana department gather into Sanhita department for lunch, and they will have lunch together. Now we will see that the teachers are having prokop. They are flowing from their sthanas to another sthanas, and when after lunch they will again go to their respective departments. Now we can say that, oh, it is a prashama avastha. It is very wrong. Please refer Rasa Vaisheshika Sutra. The Grantha is available. It is published. This Grantha is written by Nagarjuna. But as Nagarjuna's name is there and the name is Rasa Vaishesh Sutra, This grantha, when we will receive that in library, that librarian will put into the Rasa Shastra compartment. But this grantha is not related to Rasa Shastra. This classical text is related to Kaya Chikitsa, Dravya Guna and Nidan. Here in the Prakopa Prakarana, Nagarjun has described that Swasthanam Tyaktva. This is the wrong meaning. Because doshas are everywhere. Where they will flow, they are already there. So, and if you observe, I will give another reference. Charak Sutrasthan, chapter 20, sutra number 8, Chakramantika. He says that why these sthanas are described. Because here only Vata Vyadhis are observing majorly. Pakvashay Kati Sakti Shrotra Asti Sparshanendriyam. Here Vata Vyadhis are aggravated majorly. If that thought process that leaving the sthanas and flowing through another sthanas is Prakop, then we should not observe diseases of Vayu in the Pakvashay Kati Sakti Shrotra Asti Sparshanendriyam. Then why we are performing Basti in the Pakvashay? So this is all bullshit created by textbook. And textbooks written by such persons which they never seen a single patient in their lifetime. Charak should be taught by a physician, not by merely academician. No, only an academician which is not seeing any patient, he cannot able to teach Charak Sanhita as per Charak want to teach. So this is that question arises, madam. What madam has said is very correct. We can label them as Vimaragam. Yes. In his own sthanas also, if it is vitiating, that is also Prakop.
Excellent, excellent. Very good explanation with simple examples, actually. Very nice.
If I may interrupt, I'm sorry. This is Dr. Shweta Vivek. Thank you so much, sir, for clearing the doubt. That is what, and the second doubts are already cleared. As he mentioned that Maas Rotas is the where Gulma is seen, and my doubt was how do we differentiate between Grani and Gulma? So that doubt, sir, had already cleared during the session. So thank you so much.
And I will add one thing, same Samprapti is developing in the stomach outside the Mahasrutasa. It is called as Udar.
Oh, okay.
So
Okay.
PCOD is Udar.
Yes.
Liver diseases are Udar. Diseases of spleen, diseases of peritoneum, diseases of bladder, uterus, kidneys are all Udar, included in Udar Samprapti.
So
But-
Mahadevan, sorry.
But inflammatory diseases.
Okay. So if I add, I've heard Dr. L. Mahadevan sir mention that PCOS and PCOD is also one form of Gulma. So can that also be considered? If there is Shula involved, then it will be Gulma.
Raktaj Gulma.
Okay. Okay.
That is described in the day separately. So Udara, the naming given to that entity is given by our ancestors. Miss, my name is Abhijit Saraf, but I am not born with the name, na.
Correct.
When I was not able to understand anything, people have performed a function and give me a name. So this is name of the body, not the mind. So likewise, we have given name Vayu, Pitta, Shleshma, Rasa, Rakta, but all are the body elements, and they are we name them accordingly because our ancestors named them. Indian names they gave the name Shua or Kutta, or and in Britain, British gave name a dog. There is no difference. It is just a Saudnya. So Saudnya can be different, but Samprapti is the same.
Okay. Thank you so much, sir. Thank you so much. Great presentation.
Anybody has any other questions? All right.
I'm Dr. Uma Maheshwari from Kanchipuram. Gulma diseases. Can I know, sir?
Your voice
I
is breaking.
can't hear properly, ma'am.
Okay.
I-
Sir, actually, why we are using?
Huh.
Sir, here, sir, it's audible. It's
Yes, ma'am. Now
audible.
it is audible. Yes.
Yeah, okay. Like why we are using diuretic drug like Punarnava and Shatavari, Shariba in Gulma context?
Because
Sir?
it is having anti-inflammatory conditions, anti-inflammatory qualities. Shatavari is a Shothagna, Punarnava is a Shothagna, and Sariva is having such qualities that soothen the Srotasas. So these drugs are very effective in this kind of conditions. Now the treatment given in the Gulma Chikitsadhyay, they have used these drugs. But so many drugs are now unavailable to us, so we can use these conditions, these dravyas.
Namaste, Patankar sir.
Thank you,
Namaste.
sir. Thank you very much.
I want to add one thing. We must see all the Rasiviri Vipagas of each drug, and what our Abhijit is a diamond. So he is doing all those things and explaining it very well. So in my opinion, while treating any patient, the Rasiviri Vipak of each drug or each single component should be studied properly. Thank you.
Thank you.
Thank you. Thank you. Thank you everybody for joining this wonderful webinar, and thank you so much, Dr. Saraf, for wonderful presentation. It was very helpful for all the listeners. So please watch and subscribe our YouTube channel. So this recording will be on the YouTube channel of gcar. So please definitely watch it and like it, comment and share also all the videos with others. Once again, I invite you to become a member and also fill out our form, volunteer form. You can also subscribe our IU update. That's the newsletter that goes on to stay tuned up with our projects and also our events. So if you have any questions, please feel free. You can contact us at Ayurveda Research USA at gmail.com, or you can also reach out to me, asavari at mnayurveda.com. Thank you so much.
Thank you very much.